My name is Jones, and today we are going to look at infection, trauma, and wounds. In the previous lesson, we were looking at inflammation, and this is in a series at which we are looking at surgery and surgical nursing one. Okay, so the previous lesson to this one was inflammation. If you have not listened, okay, you have not listened to the lesson on inflammation, please kindly do before you come to this lesson. Okay, so when talking about infection prevention, trauma, and wounds, there are some areas that you need to revise on so that you can understand what we are going to talk about. So, like when talking about infection prevention, there's a chain of infection, okay, pathway that takes place. Okay, you can have an organism will need a reservoir where it will survive before it finds a portal of entry, okay? A portal of entry to affect another person, okay? So from the reservoir, it will leave through port of exit. From the reservoir, that is the host, it will leave through port of exit. Port of exit, it's like, let's say someone had cholera, so through fecal matters, port of exit becomes the anal or the anus. Anus. Okay, so feces are passed on. So the the microorganism is now released to the environment in order to be transmitted to another individual. So when it is transmitted to another individual, okay, then there should be a port of entry, a vulnerable area. So person is now going to drink water which is contaminated with fecal material. Hence, the port of entry becomes the mouth. Okay, so the vulnerable host then becomes infected with the infection. So, infection prevention here, we are going to look at it in the surgical sense, okay, that is in surgery. Okay, then we'll talk about wounds, okay, and also trauma. So, for wounds in surgery, we talk about healing by primary intention and also healing by secondary intention. So when you talk about healing by primary intention, it leaves a minimal scar and there's good approximation of skin, uh, the ends of the skin. So mostly these wounds that heal by primary intention are caused by surgical blades, okay? Surgical blades when suturing. Then we have wounds that may heal by secondary intention. So these are open wounds where a big chunk of um, of a tissue might have been taken. So when they heal, they form a very wide scar when healing, and it will take time. So these such wounds becomes very difficult to suture because they do not have approximated ages. So wounds can heal by primary intention or by secondary intention. So it's important you have this at your fingertip when studying surgery. So infection, trauma, and wounds. So let's start with the infection. Infection is the invasion, growth, and multiplication of organism in the body tissue. So the invasion, growth, and multiplication of organism. These are key terms in explaining infection. Okay, invasion, growth, and multiplication of organism, and this will happen in the tissue or body of a reservoir. Okay, then most of these infections are caused by bacteria, but we need to know that there are other microorganisms that are there, like viruses, fungi, and larger organisms such as malaria parasites that can cause illness by entering the tissue. Okay, and then they can cause infection or they can cause illness. Okay, so response to infection. When talking about response to infection, we can have a local response to infection and we can also have a general response to infection. So, a local response to infection is characterized by all the process occurring due to inflammatory reaction. So, when there is presence of a noxious substance or noxious bacteria on a part of the tissue, there will be a local response, okay, on that tissue, which will cause an inflammatory process. So when there's an inflammatory process, then we're going to have all the cardinal signs of inflammation. Okay, when we talked about inflammation, we talked about feel. Okay, feel is the mnemonic for cardinal signs of inflammation. So P for pain, okay, H for heat, okay, E for erythema, E for edema, L for reduction in function or loss of function. So we are saying the response to infection, there is local response. In local response, mostly we look, what you're going to have is an inflammatory reaction. And inflammatory reaction is going to give out signs and symptoms like redness, swelling, heat, pain, and loss of function, especially if the infection is acute or severe. So some of the responses to infection that we need to appreciate, of course, all these are explaining the inflammation that is happening and the parts that might be affected. So we have cellulitis. When you talk about cellulitis, we are looking at the presence and spread of infection, okay, or infectious material in tissues. So cellulitis, inflammation of these cells. So cells of the tissue. So cellulitis is the presence and spread of infection and infectious material in the tissue. Lymphangitis is the spread of infection in lymph vessels. Okay, so when you say lymphatic system, and ANG, okay, that is in reference to blood vessel. Itis, inflammation. So lymphangitis is the spread of infection in lymph vessels. But when we say lymphadenitis, okay, so lymph to do with the lymphatic system, aden to do with nodes. Okay, so itis, inflammation. So lymphadenitis is the spread of infection in lymph nodes. Okay, then let us look at another response to infection. We have looked at local response to infection, where we have discussed that local response to infection mostly constitute inflammation. And inflammation can be cellulitis, it can be lymphangitis, it can be lymphadenitis. Then now let us appreciate the general response to infection. General response to infection is characterized by the general inflammatory responses that are discussed under inflammation. We looked at inflammation in general and we looked at the general responses to infection. So one may have fever, which is mostly a characteristic feature of infection, and it's a good indicator of presence of infectious material in the body. So one who's having inflammation, okay, is having pain, okay, or is having a response to some kind of infection, fever is one of the most cardinal feature that there is presence of infection. One of the cardinal indicator that there is presence of infection. So general response to infection is that one may develop a fever, or that is the person who is affected. Then the other responses to infection, the general response to infection, include bacteremia. So bacteremia, emia, having overwhelming bacteria in the blood, emia to do with blood. So bacteremia is the spread of organism in the bloodstream. Whilst when you talk of septicemia, from the word sepsis, septicemia, septic blood. So sepsis, we are looking at the invasion, circulation, and multiplication of microorganisms, usually bacteria, in the bloodstream. So invasion, circulation, multiplication of microorganism is what we are referring to as septicemia. Bacteremia We're just looking at spread of bacterial infection in the blood. Then we have paema. Okay, paema is the spread of organism in the bloodstream with the formation of abscesses at at many sites in the body. Paema, that is emia in the blood, paemia, that is to do with suppurative, suppurative, suppurative or infected, uh, infected blood. Okay, that is infected blood that may intend to form pus, so it will form abscesses. Pyemia, that is spread of organism in the bloodstream with formation of abscess at main sites of the body. Okay, there are more terms that will make us appreciate what pyemia is. When you look at toxemia, we are looking at toxin in blood, toxemia. Okay, we are looking at the spread of toxic products of inflammation from the site of, that is from the site to the bloodstream. Toxemia, okay, toxic material being sprayed, okay, toxic material being sprayed from the site to bloodstream. Then we have suppuration, which is the process of pus formation. Okay, when we talked about pyemia, we said pyemia, we have this blood which is infected that tends to form pus or abscesses everywhere. Okay, now let us look at management of inflammation or management of infection. Okay, so you need to take a good history so that you are certain the cause of inflammation. What is important is to treat the cause, then the inflammation will go. So take note of dilation to determine whether it is acute or chronic. Find out about the symptoms the patient is experiencing. You can also find out about relieving or aggravating factors. Take a past medical history to determine if it is a recurrence. Okay, so you can use the mnemonic socket. Okay, we're not assessing for this. Okay, inflammation or infection. Otherwise, we have put that mnemonic within the presentation. It's part of the presentation. You are going to see it. So, management of inflammation, you need to know the site, okay, onset, and the like. So, we're going to discuss that one just a little bit within this lesson. So, you also need to do a physical examination. Inspect the site for local signs of inflammation, and we have talked about signs, local signs of inflammation. Okay, in our lesson for inflammation, and even within this lesson, we've talked a little bit about signs of inflammation. Okay, or signs of infection. You can do an inspection for signs of infection. Bleeding and any protrusion of organs, you can make assessment for this. Palpate area for swelling. Okay, check for enlarged lymph nodes, tenderness, or heat. Then do percussion for specific sites. May also be done to elicit signs of fluid congestion. You can do chest auscultation, which may be done to listen to chest sounds. So when talking about physical examination, mostly we look at the mnemonic IPPA, IPA. Inspect, palpate, percuss, and auscultate. And see, this is what you have just looked at. Inspect site, palpate site, okay, percussion of the site, auscultation of the chest. Okay, so now management of inflammation. How you manage inflammation, you take first investigation. This will help you to establish the cause. Okay, and also to look at the general immune system of the person that has been affected. So you're going to do white blood cell count, you're going to do an hemoglobin test, okay, to determine HB level or hemoglobin count. You can do hematocrit levels. You can do the geography of specific sites that has been affected. You can do culture of aspirate. This is to identify the causative organism. You can also do blood culture, can help you identify causative organism. You can do urine culture to rule out diabetes, which tends to affect the healing process of the wound. Okay, Now, how do you manage uh, inflammation, okay, with drugs, pharmacological management? So we have looked at investigation. Now we are looking at treatment with the drugs. So you need an antibiotic agent according to the sensitivity test. This is to eliminate the causative organism. Then you can give mostly before you have even sensitivity test. You can give a broad spectrum antibiotic, okay, this because it has got a broader range or a wider range of number of bacteria that it can kill or it's able to eliminate. Most infections are mild, and if the patient resistance is high, the infection will clear rapidly, and only simplest measures are carried out, okay, when you're treating infection. So the first in management of inflammation is antibiotic. So from A, antibiotic, the other A is anti-inflammatory drug. So anti-inflammatory analgesic drug. Okay, so that is what you're going to give. So first A is anti-inflammatory. The next A is the first A is antibiotic. The next A for management of inflammation is anti-inflammatory drugs. So anti-inflammatory drugs have also an analgesic effect. Okay, and they also have antipyretic effect. So that is why we are giving the second A. So rest coupled with good positioning and administration of painkiller will play an important role in the relief of pain. Application of warm and cold compress also helps to relieve pain. So warm compress increases blood circulation, carrying with it chemicals that may exacerbate pain, and then cold compress reduces the transmission of pain. So warm and cold compress can help relieve pain, apart from giving of analgesic drugs. Then the other important part of treatment, which is non-pharmacological, is encouraging rest. Movement causes compression of an inflamed area, and therefore spread of infection will be encouraged. It is so when a person rests an area that has got inflammation or infection, it will also help to reduce the strain or compression on that area. And also, if they continue exercising in that area, it can delay healing because there will be spread of infection. So, rest is also important because um, if the part which is involved is immobilized, it will promote healing. Rest, it can be of the local part that is involved, or generally the whole body. Okay, so rest also improves the body's immune response to infection. It activates or reduces stress within the body in fighting infection. Okay, so the other the other way in which we can manage inflammation is incision and drainage. I and D. Okay, so incision and drainage in surgical ways, here we are saying this is a surgical incision and drainage which is essential as soon as pus is formed. This reduces the number of organisms at the site and decreases the inflammatory process, which may not always be helpful to the tissue, especially in sensitive body areas. So, incision and drainage, here you make an incision on the area that has been affected, which has formed pus, so that you drain the pus. The pus there has got infection, okay, which may spread. So we want to reduce the level of infection by draining the pus. Then the other way of managing inflammation is good nutrition or balanced diet. So good nutrition will play an important role in the healing of diseased or injured tissues. Of importance, some of the things that you need to know is that vitamin C or ascorbic acid enhances the formation of collagen fibers and formation of new capillaries. Okay, proteins are going to help in repair of worn out tissues. Zinc will encourage epithelialization and general body energy reserves. Also, will assist in the healing of tissue as this tissue have got a faster metabolism. Okay, so it is important for you to add these to patient's diet. Otherwise, multivit, that is multivitamin, helps to improve patient's immunity. Okay, when you talk of multivit, they help in improving patient's immunity. But of particular interest, zinc, which encourages epithelialization, vitamin C improves immunity, okay, increases the healing or improves the healing of connective tissue, helps in formation of collagen. Here we are talking of surgical wound. So this is going to play an important role. Okay, so from there, then we can move on to uh, the other things that you can do that is good in management of inflammation and infection. This has to do with good general body and wound hygiene. General body hygiene plays a very important role in the healing of the wound and recovery from infection and its effects. This is so because a well cared for body hygienically has less infective agents that easily lead to contamination of wounds, as well as leading to creation of an environment where already existing organisms are going to thrive well. So here we are saying good general body and wound hygiene. You can do wound dressing. Wound dressing is going to help reduce inflammation. It's going to help reduce infection. It's infection which exacerbates inflammation. So it's going to reduce all this. Okay, some clients should be also educated. Okay, clients should also be educated on hygiene. Okay, hygiene. So clients we're saying should also be educated on keeping the wound clean. Okay, the hygiene of keeping the wound clean, avoiding um, avoiding non-hygienic substances. Okay, from coming in contact with the wound. So use of antiseptics. Okay, clients can be also educated on using of antiseptics. This is to reduce the number of bacteria on the affected part or affected wound. Okay, so with that, then discussed on inflammation and prevention of and how to treat inflammation or how to manage inflammation. Let us now look at trauma. Trauma, that is, we are looking at all these at the angle of surgery. So trauma is the physical injury that causes damage to the body structure or alters the body function. Trauma is a physical injury that will cause damage to body structure. So there will be either damage or alteration in body function after this impact. Okay, this impact that will cause the same trauma. So trauma can also be looked at as an injury or wound that affects or disrupts the continuity of any tissue caused by external force or violence. It generally results in a physical effect on the body, that is pain and loss of function. Let us now look at types of trauma. The types of injury can involve various systems of the body, like the skin, skeleton, okay, nervous system, respiratory, cardiovascular, digestive, renal, or reproductive system. So trauma may be thus either blunt or penetrating depending on the injuring object. By knowing the normal anatomical structure and physiology of various systems, it is possible to observe the changes that may occur due to injury to any tissue. Okay, that any tissue of these systems that we have mentioned. So, what are some of the outcomes or complications of trauma? So, some of the outcomes or complications of trauma includes inflammation. Okay, after trauma, start having inflammation as an immune response. There can be degeneration, there can be circulatory disturbances because of compression on the blood vessels, okay, by the tissues that have been inflamed. Other complications of trauma is infection, okay, because if it's an open wound or the thing that caused the the trauma was sharp, then you see that there is outer skin integrity, okay, increasing the vulnerability to infection. So hemorrhage is the bleeding that will come because of trauma. Hematoma formation, okay, and then airway obstruction if it is involving the respiratory tract. So these are some of the complications. Okay, so these are just some of the complications that may happen because of trauma. You can bear in mind wound healing. Okay, wound healing. If wound healing happens just okay, then these complications will not be seen. But otherwise, inflammation is part of the normal immune response. Okay, and sometimes wounds become infected, so all these can be avoided if you do a good emergency trauma assessment and also manage the patient very well at the hospital. Then we are less likely to have complications of trauma. Okay, so with that short discussion on trauma, let us now look at wounds. Okay, let us now look at wounds with from that's a brief description, discussion about trauma. So the learning objectives of talking about wounds is that at the end of this lesson, okay, to do with wounds, you need to describe various types of wounds. You need to be able to explain the process of wound healing. You need to be able to state the types of wound healing. You need to explain various factors that influence wound healing. Okay, so those are some of the things that we intend to achieve within our objectives. And then maybe the other addition objective, because when one has got wound, or one has got a wound, you know, they will be in pain. So pain assessment, you can use pain assessment as promised. You can use Socrates, okay, as a mnemonic tool in your assessment. Okay, so site, onset, okay, you can look at all that to do with the Socrates and other things that have been associated with the pain. Okay, so we use the mnemonic Socrates in pain assessment. Okay, so let's define a wound. A wound is a cut or break in the continuity of any tissue caused by injury or operation. A break or cut in the continuity of tissue caused by injury or operation. Then the term healing is simply replacement of dead tissue or necrotic tissue. Okay, so types of wounds. We have lacerated wounds. When you say lacerated wounds, it's a type of injury that has rough or jagged edges. That which is sustained in like road traffic accidents or from a barbed wire, okay, injury, you can have a lacerated wound. Then the other type of wound is incisional wounds. So these are types of injuries made by sharp objects. They have edges that are evenly separated, like those wounds made by surgeons during surgery. Then we also have punctured wounds. These are wounds that are caused by sharp pointed objects, causing a small opening through the skin. Okay, so the examples that we can give to do with punctured wounds are wounds that may result from nails, knives, or gunshot wounds. So these are going to give you a type of wound which is known as punctured wounds. So punctured wounds appear small superficially, but um, they involve deeper structures such as nerves, blood vessels, or viscera, which may be damaged and contamination carried into deeper tissue. Then we also have contused wounds. So these are a type of wounds that involve superficial injuries without damage to the skin surface. They are commonly caused by blunt surface forces and are characterized by considerable soft pad. Their known common causes is necessarily hematoma, contused wounds, type of wound involving superficial injuries. Then poisoned wounds. These are wounds. Okay, these are wounds. Okay, these wounds are those type of wounds that necessarily involve direct contamination by the source of injury, such as snake bites, okay, insect stings, dog bites, especially where rabies organisms exist. So these form category of wounds, okay, which we call poisoned wounds. Then abrasions. Abrasions are wounds that result from rubbing a body tissue, especially the skin, against a rough surface, leading to loss of superficial tissue due to friction. These are characteristically painful and superficial. Okay, so with that, let us now look at, with that discuss on types of wounds, let us look at some surgical classification of wounds. We have contaminated wounds. These are wounds which are exposed to excessive amounts of bacteria. These wounds have a higher risk of infection. For instance, unprepared colon surgery or death laceration. Contaminated wounds, wounds that are infected, okay, or have excessive amount of bacteria. They have been exposed to excessive amount of bacteria. So these are contaminated wounds. Okay, apart from contaminated wounds, okay, that are exposed to excessive amount of bacteria, we have infected wounds. So these are wounds that have infected material in them. They usually have pus or slough on their surfaces. Common infecting organisms include streptococci, staphylococci, and other bacteria that might be maybe normal flora on the skin, and then when introduced to a different area cause infection. Okay, so the other type of surgical wounds that we can look at is clean wounds. Okay, so we have looked at two main types of surgical wounds, which is contaminated wounds and infected wounds. There's some similarities there. When you say contaminated, it's wound that is exposed to infection or bacteria. Whilst infected wound is wound that already has dead tissue. Okay, may have pus, okay, and slough or dead tissue. Commonly, this infection there that might be there is streptococci or staphylococci. Then we have clean wounds, which is an opposite of infected wounds. So there are wounds that have been rendered clean by cleaning with the use of disinfectants such as Savlon, povidone, iodine, or methylated spirit. So those are clean wounds. Debrided wounds. There are wounds whose top infected or necrotic tissue, okay, has been removed surgically by a process known as schlafectomy or debridement. Debrided wounds, wounds, okay, after schlafectomy or debridement. So these are debrided wounds. So wound healing occurs in three phases. Thus, there is inflammatory, there is proliferative, and there is maturation. Okay, so we are looking at wound healing, and the phases is inflammatory, proliferative, and maturation. So inflammatory, also known as lag or exudative phase, Okay, in this phase of wound healing, a blood coat forms, the wound becomes edematous, and debris of damaged tissue and the blood clot are phagocytosed. So, in the inflammatory phase, there is phagocytosis. Okay, phagocytosis of fallen tissue, and then it is inflammatory stage. So there is edematous of the wound, or the wound becomes edematous. So it becomes edematous because of extravasation of fluids into interstitial spaces. Okay, the capillaries become highly permeable, leading to um, leading to evisceration of some fluids into the extracellular space. So this is what is going to bring about edema. So inflammatory or exudative phase is the first phase in wound healing. So it usually takes 1 to 4 days. Then we have proliferative or fibroblastic or connective tissue phase. So in this phase, okay, in this phase, collagen is produced, granulation tissue is formed, and there is increased wound tensile strength. This would take 5 to 20 days. So in proliferative phase, we are having a formation of scar. Scar is formed by fibrin, fibroblastic, okay, and other connective tissues. So this we are calling it proliferative because some new cells are being formed. So new cells are being formed. So there's granulation tissue which is formed. Okay, which is formed. So it will take about 5 to 10 days. Then there's maturation. So in maturation, there is a differentiation, there is resorption, or there is resorptive process, there is or remodeling phase. Okay, so the third stage of wound healing is maturation phase. So now, in looking at maturation phase, also known as plateau phase, okay, it is characterized by leaving of fibroblasts with more tensile strength. Okay, so now um, we are looking at maturation. So here, what is happening in maturation phase is that are collagen fibers are reorganized and tightened to reduce the scar tissue. So it occurs from 21 days to months or even years after the injury. Okay, so that is in the nutrition. So in nutrition, there's reabsorption, there's remodeling. So this phase ensures the prevention of big wounds leaving a very big scar. So that's why there's resorption. And then there's the remodeling. There's differentiation of cells so that it does not leave a big scar. Okay, so types of wounds healing. So types of wound healing, as earlier stated in our introduction, is that we have healing by first intention or primary union. Okay, so this type of wound healing, which takes place aseptically with a minimum or no tissue destruction. The wound margins or edges are neatly approximated with little granulation and scar formation. So, uh, types of wound healing. So we have wound by first, by primary intention. No, literally leaves a small scar or minimal scar, or literally no scar with the wound has got well approximated edges or margins. Then healing by second intention or granulation. So this is a type of wound healing that occurs on wounds that result from trauma or laceration, ulceration, infection, and with irregular wound edges. There is extensive tissue loss that makes wound edges difficult to approximate in wound healing by second intention or granulation. Tissue growth will start from the depth to the surface upwards and from sides to the center. Granulation becomes the primary feature of secondary intention wound healing and scarring. Then the third type of wound healing is healing by third intention or secondary suture, also called healing by tertiary intention, which is a type of wound healing which occurs when there is delayed suturing of a wound if there is a breakdown of initial suture with massive infection or loss of tissue. Two opposite granulation tissues are brought together with the result of a deeper, wider scar. So that is healing by third intention. Healing by third intention, we also see it in a skin graft. Okay, so we also see it in skin graft where we have um, to wait for health tissue to grow before we can do the skin graft. Okay, so now let us appreciate factors influencing wound healing. So we can have local factors and we can have general factors. So local factors are factors that directly influence the characteristics of the wound itself. So the first factor influencing wound healing is oxygenation. Oxygen is important for cell metabolism, especially for energy production, and is important in all wound healing processes. The other factor that may affect wound healing is infection. Bacterial colonization of the wound may delay the healing process of the wound, and infection delays healing by either mechanical separation of wound edges or decreased blood supply, or may prolong inflammatory and debridement phase. Okay, then infection may also produce proteolytic enzymes which digest the tissues. Then the other factor which may influence wound healing is blood supply. Adequate blood supply to the affected area is essential because blood carries with it food components that is needed for wound healing. So, when you have adequate blood supply, it will promote wound healing because we have said blood carries with it nutrients that will help in wound healing. So the other factor is foreign body. If there's presence of a foreign body, it will inhibit wound healing as the body's reaction to foreign body will begin immediately after injury, leading to accumulation of exudate at the site of injury. This then leads to formation of uh, foreign body gain cells, encapsulation of foreign object, and chronic inflammation. The Let us now look at factors that may affect wound healing to do with the general systemic to do with the general systemic perspective of the body. So the other factors that may affect wound healing away from the local factors is age. The physiological changes that occur with aging places the older patient at high risk of poor wound healing. Reduced skin elasticity and collagen replacement influences healing. The immune system also declines with age, making older patients more susceptible to infection. Older people can also present with other chronic diseases which affect their circulation and oxygenation to the wound. Children's Children's wounds heal faster than the elderly because of good supply. Advanced age slows collagen synthesis by fibroblasts. Hence, this will impair circulation and require long time for epithelialization, okay, of the skin and alters phagocytic and immune response. Okay, other factors affecting wound healing is dehydration. This will lead to an electrolyte imbalance and impaired cellular function. It is a particular problem in patients with the burns. The other factors that may affect wound healing is drugs. Okay, antibiotics decrease the frequency of infection, but decision to use systemic, local, or any would be based on patient's condition, type, length, and environment of surgery, wound contamination, and immune status. Okay, so when you use NSAIDs to do with the drugs anti-inflammatory effect drugs, these they will bring positive influence to wound healing. When you use corticosteroids, they will retard wound healing, particularly if given before inflammation begins. Corticosteroid therapy impairs phagocytosis and inhibit fibroblast proliferation and function. Corticosteroids also depress formation of granulation tissue and inhibit wound contraction. Okay, so the other systemic factor influencing wound healing is nutrition. Good nutrition boosts immunity and thereby it will promote wound healing. Nutrient deficiencies in vitamin C will delay formation of collagen fibers and new capillaries. Then the deficiencies to do with protein will impair or decrease amino acid supply for tissue repair. We also have established that zinc also is needed for epithelialization. So if there is dehydration, so if there is no balanced diet with presence of zinc, then it will impair epithelialization. Other factors affecting wound healing is metabolic status. Patients with diabetes mellitus have a decreased collagen synthesis, and this retards early capillary growth and impairs phagocytosis. It will also reduce supply of oxygen and nutrients secondary to the disease. The other systemic factor affecting wound healing is immunity. Poor general health causes generalized absence of factors necessary to promote wound healing. Okay, management of a client with wounds. Okay, how do we manage a client with wounds? So determine when and how the wound occurred. Okay, so it's important to do this because treatment delay that exceeds 3 hours will increase infection risk. Using a safety technique, the clinician can inspect the wound to determine the extent of damage to underlying tissues. So, sensory, motor, and vascular functions should also be evaluated for changes that may indicate complications. So, trauma complications may be to do with tissue perfusion, respiratory problems, depending on the parts that have been affected with the wound. So any small bleeding vessels should be clamped and tied. After wound treatment, a non-adhesive dressing should be applied to protect the wounds. Antibacterial agents such as povidone, iodine, or hydrogen peroxide should be used on the wound, but these should be allowed. These, but They should be used on the wound, but these should be allowed deeper into the wound in order to reduce infection. So they are used initially in the treatment of the wounds, that is locally, and then disinfectants are commonly and routinely used in the management of wounds, and they include Savlon, Colexidine, and Hibitine. These disinfectants help in reducing the population of microbes by inhibiting their growth or killing them by their macrostatic or microbicidal effect. Okay, the area around the wound should be kept clean. Hair around the wound should be removed, especially if it is expected that the hairs will interfere with wound healing and closure. The wound should be irrigated with enough saline solution or polymer to remove surface dirty. Okay, devitalized tissue and fallen matter are removed because these impede wound healing and may encourage infection. Okay, a dressing can be applied to a wound for one or more of the following reasons. One, to provide a proper environment for wounding. Two, to absorb excessive drainage. Three, to splint or immobilize the wound. Other reasons is to protect new epithelial tissue from mechanical injury, to protect the wound from bacterial contamination and from soiling by feces, vectors, or urine. The other reason is to promote hemostasis, as in a pressure dressing, and also to provide mental and physical comfort over the patient. Okay, so all these are should be used in promoting wound healing. As wound heals, many elements such as adequate nutrition, okay, cleanliness, rest, and position will determine how quickly the process occurs. Although post-operative dressings are initially changed by a member of the surgical team, subsequent dressing changes in the immediate post-operative period are usually done by the nurse. Okay, so with that discussed, let us look at types of wound dressing. Wound dressings are done according to the immediate assessment, state of the wound, and the objective of the surgeon consent. Thus, dressing may be described as wet dressings. Okay, so we have moist dressings, and we also have moisture. Okay, so we have moisture retentive dressings, and then we also have occlusive dressings. Other types of dressings include dressings, medicated dressing, and also medicated dressings. During your clinical experience, you have to learn how to dress wounds using a specific method that have been described within the procedure manual. So we can have medicated dressing, pressure dressing, we can have moisture retentive dressing or aggressive dressing. So there you have it. Within this lesson, we were looking at three different items. So we're looking at infection, we're looking at trauma and wounds. Within this lesson, we have emphasized the need for infection prevention in the surgical unit. We have talked about different types of trauma. Okay, we have talked about wounds, and we have also talked about phases of wound healing and how to manage wounds. So from me, I'm saying thank you and keep studying.